So today we're going to talk about an article by Richard Bentall in 1992 that he published in the Journal of Medical Ethics called A Proposal to Classify Happiness as a Psychiatric Disorder. In this article, Bentall proposes that happiness is to be added to the major diagnostic manuals as major affective disorder, pleasant type. He argues that, to quote, happiness is statistically abnormal, it consists of a discrete cluster of symptoms and is associated with a range of cognitive abnormalities, such as a disconnect from reality, and probably reflects the abnormal functioning of the central nervous system. And Bentall is trying to use the lack of interest of making happiness as a psychiatric disorder to point out the absurdity of the medical model of treating disorders instead of individual symptoms. The primary reason that happiness is not really seen as a psychiatric disorder is that it's not perceived to be an annoyance to the functioning of a society. By comparison, schizophrenia is a more unstable set of diagnostic criteria, and as a disease it receives a disproportionately large amount of funding and attention compared to other psychiatric ailments, in particular anorexia, which has been chronically underfunded for decades. So, how is happiness described in the literature as of 1992? At the time, it was seen as a spectrum ranging from simple contentment to elation and joy. Somebody might describe feeling a general level of life satisfaction and having an increased level of self-belief. There are also behavioural components to happiness, such as being carefree, impulsive in your behaviour, and unpredictable. You might exhibit a higher frequency of engaging in risky recreational activities, like increased alcohol consumption and overeating, and then you might be prone to invading the personal space of other less happy people and try and force happiness upon them. So, how could we detect happiness? We could obtain a behavioural baseline of an individual and then observe them, but that would be quite time consuming and expensive. And in other psychiatric disorders like depression, it is quite common to use a self-report questionnaire. At the time of publication, the incident rate of happiness is unknown in the general population. We cannot use unhappiness or depression as measures for a comparator because the lack of presence of unhappiness and depression does not indicate happiness. Existing measures at the moment are not to be seen as reliable because they are not created using a robust definition of happiness as a concept. But if we were to label happiness as a disorder, what would that actually look like? Well, it can exist as either an acute or a chronic state, and it would be on a spectrum of affect because high intensity happiness is correlated with high intensity of emotion, and it's so that it's more about the disinhibition of the individual rather than an imbalance of emotion like you might get in mood disorders. So while there's only a small base of empirical support at the time of publication, Bentall argues that this is comparable to other psychiatric disorders like schizophrenia, and that if schizophrenia can be seen as a distinct syndrome on that basis, then there is absolutely no reason that happiness syndrome cannot be included as well.